Next, we will discuss penetrating eye trauma. Disclaimer, still the same. Learning objectives as usual. So in this lecture, we will identify the signs, symptoms, and initial treatment of penetrating eye trauma in the TFC. If a penetrating eye injury is noted or suspected, perform a rapid field test of visual acuity and document findings. Cover the eye with a rigid eye shield. Ensure that the 400 mg of moxifloxacin tablet in the combat wound medication pack is taken if possible, and that IV or IM antibiotics are given as outlined below if oral moxifloxacin cannot be taken.
If a penetrating eye injury is noted or suspected, perform a rapid field test of visual acuity and document the findings. Vision measurement has to be simplified for battlefield use. Don't worry about charts. Determine which of the following the casualty can see. Read print, count fingers, hand motion, light perception. Remember, if vision is going down and the eye area is swelling rapidly, there may be a hemorrhage behind the eye, and the casualty should be evacuated as soon as possible. This can happen with fragments that miss the eye but injure the orbit. He or she may permanently lose vision due to increased pressure in the eye if they don't get to a hospital as soon as possible. This is a laceration to the cornea of the eye, the clear part in front. Eye contents can leak out if you have an injury like this, and bacteria can get into the eye and cause infection. A small penetrating eye injury may look like this dark spot, where the clear part of the eye and the white part of the eye come together. The dark spot is a bit of iris, one of the pigmented parts from inside the eye that is trapped in the penetrating wound. Attempts to wipe this spot away can cause more of the iris to be pulled out of the eye. Infection inside the eye is always a bad thing. Corneal lacerations, or penetrating eye injuries, can cause infection and lead to permanent blindness. Ensure that 400 mg moxifloxacin tablet in the combat wound medication pack is taken if possible, or that IV/IM antibiotics are given if oral moxifloxacin cannot be taken. Cover the eye with a rigid eye shield, not a pressure patch. A rigid shield will protect the eye from any pressure. Pressure could force the interior contents of the eye to come out. This is a bad thing. A rigid shield should be in first aid kits and medical sets. When only one eye has been injured, do not place a shield over the uninjured eye to prevent eye movement. Movement has not been shown to worsen the outcome for the injured eye. Blindness makes an otherwise ambulatory casualty a litter patient, and blindness is psychologically stressful. Rigid eye shields should be placed over both eyes only when you are sure, or at least strongly suspect, that both eyes have been injured. Tactical eyewear can be used to protect the eye if no eye shield is available. Use of tactical eyewear is an excellent way to prevent this type of injury from happening in the first place. In summary, remember to perform a rapid field test of visual acuity and document the findings. Cover the eye with a rigid eye shield, not a pressure patch, and administer antibiotics for all known or suspected eye injuries.
procedures you will learn today are based on the principles found in the Tactical Combat Casualty Care Guidelines, the Institute of Surgical Research and Joint Trauma System Clinical Practice Guidelines, and Vision Center of Excellence recommendations. Medics, corpsmen, EMTs, and emergency response personnel, even bystanders or battle buddies, will most likely be the first responders to a scene. As such, your actions will determine if an individual site can be saved or lost. Although the eye accounts for only 0.1% of the total body surface area, eye injuries account for 10 to 15% of combat wounds, and for 10 to 25% of injuries from natural disasters and terrorist acts. Over 30% of combat head wounds will have associated eye damage, as will many civilian and terrorist polytrauma injuries. And because the eye is notoriously unforgiving to damage, the initial treatment at the point of injury often sets the foundation for the ultimate outcome.
You know where you're at?
Do suspect eye injuries if any part of the eyelid or eye is damaged. There may be an underlying penetrating eye wound.
Give me Parrish. I need a medevac now.
Be particularly suspicious of any type of damage of any degree to any of the tissues that would otherwise be protected by eye armor or sunglasses. Eye injuries can easily be overlooked or missed. Blood, dirt, and debris that accompany trauma may mask eye damage and make the task even more difficult, as does darkness. The closer a laceration is to the eye, the more suspicious you should be that there is a penetrating eye injury.
Wrong company's here.
Unlike most wounds, where pressure is usually the appropriate first response, it is vitally important not to put any pressure on the eye. Patches, dressings, or gauze should never be placed under the shield or on top of the eye, as that could transmit external pressure, causing delicate intraocular tissues to extrude, leading to limited vision, blindness, or loss of the eye. The single most important principle in treating an eye injury is to protect the eye from pressure and additional trauma by applying a rigid shield over it.
Whoa, 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 whoa. Never pressure on the eye. Never pressure on the eye.
Sorry, Doc. How can I help then?
I need you to do exactly what I tell you to do.
Okay.
Get in the bag, give me 2 shields,
Gotcha.
if there are 2. If not, grab me some goggles.
The only time you should not immediately shield an eye is following chemical exposure. If dealing with a chemical injury, irrigate the eye immediately and copiously before doing anything else. Chemical wounds can quickly cause irreparable damage to the eye or even blindness.
Good thing those fuel cans didn't explode out there. We'd have some serious chemical issues to deal with.
Sergeant Bennett, can you and HM2 Janice come up and show us how you would place and secure the eye armor? Almost anything that rigidly vaults the eye can serve as an effective shield. Aluminum shields are malleable enough to allow for modifying the vault and contour as needed, while still maintaining rigidity. Polycarbonate shields are exceptionally firm and maintain excellent protection, provided the curvature is deep enough to clear the injured eye. In the event a commercially designed rigid shield is not available, various substitutions can be utilized. A primary alternative is the service member's anti-ballistic eye protection, or iPro. Because eye protection is made of ballistic-grade polycarbonate plastic, it is exceptionally rigid, even when slightly damaged. Similar commercial iPro can be used in civilian scenarios, such as runners or cyclist iPros. Other alternatives include the bottom of a coffee or paper cup, though this option may be more applicable to civilian and urban settings than remote combat environments. Yet another alternative could be using a moldable splint. In short, anything that rigidly vaults over the eye without touching it to prevent and redistribute pressure can act as an effective shield. Once the shield is placed over the eye, it can be secured in any fashion.
Do you want some saline or ointment?
No, we never put anything into the eyes. Never put anything in the eyes.
When authorized, start systemic antibiotics early within a military combat environment, but do so only if it does not induce nausea or vomiting. You want to minimize convulsive movement. If possible, check the vision in each eye separately, but do not pry open a swollen or closed eyelid in order to do this.
Your eyes, can you see me?
Yeah, I can see, Doc.
Okay, great. Still see me.
Secure the eye with a rigid shield to protect and prevent further injury. The key aspect of any effective shield is that it vaults cleanly over the eye without touching the lid or eye, by resting on the orbital bones of the forehead and cheek. The shield will prevent direct pressure from reaching the eye, and it protects the damaged eye from further accidental direct trauma and environmental particulates. Thank you, Dr. Thomas and Sergeant Hall. Additionally, this is a perfect example of how to place eye pro with a head wrap. Always place a shield or eye pro over the eyes first, and then apply the wrap. Do not allow the wrap to cover the eyes directly, even if they are uninjured. Ocular injuries require prompt evaluation and treatment by specialists. The sooner the casualty is referred to an ophthalmologist for treatment, the better the potential outcome. Even though eyes are extremely delicate organs, they can be resilient if given a chance. Many severely injured eyes can be repaired at a medical facility if they are dressed properly in the field.
Go ahead, go get me a stretcher now. We're gonna tie him up so we can get him out here.
Roger that.
By using eye shields, you'll be positioning your patients for the best possible vision health outcomes. It is the single most important action in saving vision. Remember, shields save sight.
So, use of tactical eyewear is an excellent way to prevent this type of injury. If no eye shield is available, tactical eyewear can be used to protect the eye. Retrobulbar hemorrhage, orbital compartment syndrome, mentioned in the video. Similar to extremity compartment syndromes, the orbit is a restricted compartment. Trauma may cause bleeding in the orbit, and bleeding increases the pressure in the orbit and eye. In addition to the obvious lid swelling, this casualty also has forward displacement of his left globe, indicating that there is increased pressure in the orbit. Retrobulbar hemorrhage. What signs? Pain, proptosis, decreased vision, something like bloody blind, and bulging. Causes elevated pressure in the eye, also may cause permanent blindness due to lack of blood flow or optic nerve damage. Must get the pressure in the eye down quickly. Emergent evacuation is needed, and lateral canthotomy is the definitive management.